Welcome learners. So in this session we are going to learn about restraints. We are going to see how to make restraints, what are the principles behind using restraints, the nursing responsibilities and the procedures used. So talking about the definition of restraints, a restraint is defined as any physical or chemical means or device that restricts client's freedom to and ability to move about and cannot be easily removed or eliminated by the client. Let us look at the classification of restraints. So the restraints basically used for children can be of two types. So any of these two types of restraints can be used, like physical restraints and chemical restraints. So as the name indicates, physical restraints, a physical restraint is defined as any manual method or physical or mechanical device, material or equipment attached to the child's body that the child cannot remove easily, which restricts freedom of movement or normal access to one's body. The other type of restraints that can be used are chemical restraints. So a chemical restraint is defined as any drug used to sedate the child and restrict movements for discipline or convenience and not required to treat medical symptoms. So basically chemical restraints are used for psychiatric patients, commonly not used for pediatric clients. The purpose of restraints, there are many purposes that restraints serve, listing a few. First, to carry out physical examination. Second, to provide safety to the child. Third, to protect the child from injury. Fourth, to complete the diagnostic and therapeutic procedures like intravenous cannulation, dressing, etc. Fifth, to maintain the child in prescribed position. Sixth, to reduce the discomfort of child during some tests and procedures like specimen collection. The points to remember while restraint: always select safe and appropriate restraint. Restraints should not be too tight. It should not interfere with the normal circulation. Use appropriate cotton pads for maintaining the comfort of the child. Restraints should be demonstrated to the child on the child doll to gain the cooperation and reduce the anxiety. Always maintain comfort to the child and maintain body alignment. Open the restraints knots when the side rails are eased to prevent traction. Observe the restraint every 20 to 30 minutes to prevent any complications. Change the side of the child to prevent pressure sores. Do not make too tight knots. The knots should be easily releasable. Do not provide purposeless restraining. Do the recording and reporting properly. So these were the various points that as nurses you must know and must keep in mind while you are restraining the child. Coming to the various types of restraints, which I will be also demonstrating later on. The types of restraints are, these are basically physical restraints. The first type is mummy restraint. So a mummy restraint is used for children to restrict the movement of the limbs. It is used in children during examination and while performing any procedure and treatment of head, neck and face. For example, during scalp vein puncture, ear examination, eye irrigation, gastric gavage and gastric lavage. You can also restrain the baby just while giving bath. You can restrain the baby in mummy restraint and hand over the baby to the mother for giving bath. The procedure of mummy restraint: take a blanket or draw sheet and spread it on the bed or table. One corner of the small blanket is folded backward. The infant is then placed on the blanket with the neck at the edge of the fold. Straighten one hand of the baby. Tuck the sheet of this side under opposite side of the body. That is, wrap the baby's body by holding the corner of the sheet and tucking it under the body on opposite side. Now straighten another hand and wrap the child's body by holding another corner of sheet and tuck it. Now take the rounded sheet at bottom near the leg and fold it towards the chest and tuck it at the level of chest or pin it at lower end of the sheet. To make the mummy restraint, we need a square piece of cloth or a towel. Place the towel diagonally. Fold one corner of the towel at the back. Place the baby over the towel. The neck should be at the margin of the towel. Straighten the right hand of the baby. One corner of the towel will be going under the body of the baby and is tucked under the body. Straighten the left hand and tuck this corner under the body. The corner towards the legs of the baby is folded like this. It may be secured here with the help of a pin. This is how we make mummy restraint. Next type of restraint is modified mummy restraint. We need to keep the baby in mummy restraint first. So wrap the baby in mummy restraint. The margins of the top are to be folded in collar fashion like this in order to expose the chest of the baby. This is how we make modified mummy restraint, and we expose the chest area of the baby along with the neck. Any procedure that is to be done on the chest or the neck or the head, for all these types we can use modified mummy restraint. The second type of restraint is elbow and knee restraint. Elbow and knee restraint is used to control the flexion of elbows and knees. In this type, a ready-made cloth with 6 to 10 pockets is used. Place the cotton on sides of elbow and knee and then place wooden or plastic strips on pocket cloth. These pockets are vertical. Place the cloth on elbow and knee and adjust it with central location and tie both side strips properly. This elbow restraint is used in case of face and head surgeries, after surgery of cleft lip and cleft palate, scalp vein infusion, heart injuries and sutures, etc. In the picture you can appreciate the kind of cloth and the vertical pockets that we create in the cloth for preparing elbow and knee restraint. The third type of restraint is abdominal restraint. This restraint is used to hold the infant in a supine position on the bed. Abdominal restraint should not be too tight so that it does not interfere with respiration and bowel movements. For this restraint, wide-sized abdominal binders are used. You can appreciate in the picture abdominal binder. The next type of restraint is ankle and wrist restraint or splint. This restraint is used to immobilize the extremities. Various methods like splint application can be used to restrain ankle, wrist and elbow. Splints can be made from plastic, cardboard, hard paper and cotton and gauze pieces. These can be applied wherever needed. Next type of restraint is glove hitch restraint. It is used to immobilize the leg or arm. The material for glove hitch can be soft cloth, crepe bandage and an inch wide gauze bandage. You can appreciate in the picture how to create the knot and tie extremities using the glove hitch. This restraint is used when the child is having an infusion going on in the extremities, or it is also used for restraining of psychiatric clients. Let me show you the articles that we need for the procedure. We need a tray containing a square piece of cloth. We need a splint, an adhesive tape, a bandage for making the glove hitch, some cotton, bandages of appropriate sizes and some dressing pads. Let me show you the procedure of making a glove hitch restraint. For a glove hitch, we need a rope or a gauze bandage. Inside the gauze bandage, I have placed little of cotton to make the glove hitch knot. Fold one end of the bandage like this. Another end has to be folded in this fashion. Pull both the ends together. So this is how we make a glove hitch. Now placing of this glove hitch, over the extremity. So before we place glove hitch over the extremity, we need some cotton. This cotton is to be wrapped around the extremity, either the hand or the leg. Then we slip over the glove hitch over the extremity and tighten the knot. Tighten it, and the end of the bandage can be tied to the bed frame. It should not be tied to the side rails. This is how we make a glove hitch knot. Procedure of making the glove hitch. Firstly, apply the cotton pad over the wrist or ankle to provide comfort. Prepare a figure of 8 by the bandage and place it on the wrist or in the ankle and tie the bandage by knot. Knot should not be too tight or too loose. Child can remove the knot if it is too loose, and too tight knot can impede with the blood circulation. The fingers and toes should be checked for discoloration or any skin rashes. The next type of restraint is mitten restraint. It can be completed by making a mitten. The mitten covers all fingers of a hand and restricts the movement of fingers. The hand can be wrapped by gauze, or hand can be put in a bag-like pouch that can be tied properly at the wrist of the child. This type of restraint is used in case of facial surgeries, burns, intravenous infusions, any eczema of face and body parts where scratching is to be avoided or prevented. Next type of restraint is, let me show you the procedure of a mitten restraint. In order to make a mitten restraint, give little bit of cotton in the hand of the baby. Make a fist. Cover the fist also with some cotton, and then starting from the wrist, secure this cotton with the help of bandage. Cut the bandage and tie a knot here. This is how we make a mitten restraint. Crib net restraint. As you can appreciate in the picture, a crib net is a net used to cover the child's cot. The net is attached to the cot frame. Inside the crib net, the child is totally free to move. No movement is restricted. It mainly prevents the child to climb and fall from side rails of the cot. Another type of restraint is jacket restraint. In this method, a jacket made up of soft cloth is used. This jacket has laces at the back and 2 long strips. The laces are tied at back and long strips are tied at the side below the rails under the mattress. The child can sit and sleep in supine position while wearing the jacket. It can be used on chairs also. This restraint is used to avoid the child from climbing over the side rails, climbing out from the chair, bed, cot, etc. It prevents the child from fall and injury. Coming to the complications of restraints. If restraints are not used properly, it can cause various complications or hazards. It can interfere with the child's muscular development due to lack of movement. If restraint is too tight, it can cause obstruction in blood circulation, leading to tissue damage, redness, scar formation, discoloration of skin, etc. Dislocation of shoulder joint may occur if the child struggles during application of arm restraints. Pressure sores may develop if the child is kept restricted for long periods of time and does not have frequent change of position and skin care. Hypostatic pneumonia may also occur due to immobility. Ischemia or nerve damage may occur due to constructive restraints. Psychic injury to the child as the child feels that she or he is punished may occur. Similarly, disturbance in psychosocial development may also be seen if the child is restrained for very long times. Chemical restraints can cause low blood pressure, heart rhythm problems, and slow or shallow breathing. This can affect how much oxygen your child gets. Chemical restraints can also cause drooling, shuffled walk, muscle spasms, and stiffness along with tremors. General considerations that one must keep in mind while using restraints are: proper amount of cotton pads should be used under the restraints. The restraints should not be too tight or too loose. Vital signs such as heart rate, breathing rate, blood pressure should be taken often to ensure that they are in normal range. The child may become more angry or violent while in restraints or seclusion. He may struggle against physical restraints. This can cause skin wounds or block blood flow. It can also increase the child's heart rate and breathing rate. So, this can be life-threatening. Pulse distal to the restraints should be checked to ascertain adequacy of blood circulation. The child's skin under the restraints should be assessed frequently for any injury or issues related to blood flow. The child's physical comfort should be monitored closely. The child's behavior should be monitored. Physical restraints should be removed as soon as possible. Maintain proper recording and reporting. Thank you.